Browns tight end David Njoku shared pictures for the first time of his burn injuries, proving once again that football players are some of the toughest athletes on the planet. Welcome back, everybody. I'm Dr. Brian Sutterer, and my goal in this channel is to help teach you about the medical side of the sports world. And we're going to use this example of what unfortunately happened to David Njoku to talk a little bit about some key points to learn regarding burn injuries with anatomy, classification, and then how we describe severity in terms of how much surface area is covered, which can help guide treatment and resuscitation of severe burns. It looks from this picture, at least that was shared on Njoku's Instagram, that this primarily involved his face, or at least the front of his face, from what we could see in terms of the extent of his burn injuries. If we look at this picture when he came back and played, we can see that really it looks like his torso, his arms are spared, and really we were dealing primarily with just the face. Now, when we look at this picture, you can kind of see through in his glasses that maybe there's some padding or some bandages on one of his hands, but really thankfully it seems like we're just dealing with the face, which leads to the first concept to learn about this called the rule of nines. The rule of nines is a concept to estimate the severity of a burn in terms of surface area of the skin that's covered. The big complication whenever people have extensive burns on their body is fluid loss because of how the skin and overlying tissue can get destroyed. And so when you're trying to figure out how much fluid resuscitation to do in somebody who has severe burns, you need to get some sort of rough estimation of how extensive the burns are. And so there's this concept called the rule of nines that helps medical providers estimate what percentage of the body has been affected based on total surface area. Roughly, this breaks down into a lot of different components of 9. So the entire head is going to be 9%, with the front being 4.5, the back being 4.5. The legs are going to be 9% front and back, 9% front and back. The entire arm is going to be 9%, so 4.5 the front side, 4.5 on the back side, and then the remainder in the torso. So this gives doctors a rough estimation based on where the burn is in terms of what percentage of the body is covered. Keeping that rule of nines concept in mind and looking back at what Njoku shared, we can see just with the front of his face being burned, that's going to be around 4.5% of his total body surface area, plus whatever was going on in the hand. So that's the first concept to learn about here, the rule of nines for estimating the extent of surface area of the body that's affected. The next is then just how we classify severity in terms of how thick the burn affects the skin. The older classification we're probably familiar with was first, second, third, or fourth degree, but there's this new way of classifying burns that are a little bit more accurate to the anatomy in terms of which layers of the skin are affected. So this is a diagram of the skin from the UpToDate website, and the big thing to remember are the epidermis and the dermis. The epidermis is the outermost layer of skin. Epi means outer, and then the dermis is the middle layer of the subcutaneous tissue where the hair follicles, sweat glands, and some of the blood vessels reside. Below that, you're going to have some subcutaneous fat and then, of course, muscle. The old school first degree burn is now considered just an epidermal or superficial burn, involving just this epidermis, this top layer of skin, and not all the way down into the dermis. That looks more like what's probably happened here with Njoku is just a first degree, or the new method, a superficial epidermal burn. Second degree burns are now referred to as partial thickness, and then further broken down into superficial partial thickness or deep partial thickness. Superficial involve just kind of the top layer of the dermis. The deep partial thickness involve all the way down through the lower portion of the dermis. And then old school third degree burns are now full thickness burns that involve the entirety of the epidermis and sometimes down into that subcutaneous fat. And then fourth degree is a deep burn injury, which goes all the way down to the underlying muscle, potentially the bone. So with Njoku, the fact that we're still seeing skin here, this is not going to be all the way down to the dermis. My suspicion is this would be first degree or just superficial epidermal burns. It's unbelievable to think that he was able to play through this. Just even as snug fitting as a football helmet is, there's always going to be that jostling, that twisting, probably making this extremely darn painful, especially if some of it involved his hands. So just an absolute testament to the toughness of Njoku. And hopefully you're able to learn something here about rule of nines and how we classify severity of burn injuries. Thank you as always for watching. Let me know any questions or comments down below. And until next time, we'll see you later.